News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. We've got a really good show today. In our last two segments, we're going to be talking with Jeff Rice, who is the Director of Outpatient Services, Psychiatric Services at St. Mary's, about the new programs that they're developing. However, in our first two segments, we're going to be talking about a really important topic that sends chills down the spines of teachers and parents and students, and that topic is bullying. And we have a wonderful guest today joining us, Catherine Laden, who is the coordinator of Washoe County School District's Safe and Drug-Free program. And so, Catherine, we're so glad to have you here. I think the first thing I'd like to ask you, very simply, is, Catherine, what are bullying behaviors?
Well, and I think that's an important question because there's a lot of confusion about the difference between conflict, which is a normal, healthy behavior when two people might disagree with one another and have to work out a solution, and bullying. And bullying is generally repeated behavior that is harmful to the individual, that where there's a perceived or real imbalance of power. Mm-hmm. And bullying can be direct or indirect, and direct behaviors would be quite the obvious physical aggression and things like that, whereas indirect behavior could be nonverbal threats and intimidation. It could be bullying someone through another measure or device, and we've been hearing a lot about cyberbullying, and so cyberbullying is bullying using technology, and that's something that a lot of people are talking about nowadays.
So with cyberbullying, or even kids talking among one another, things like gossip and slander, is that included under bullying?
Well, actually, yes. I mean, it can be, and because it is a form of indirect verbal beratement of another person, or sharing information that might compromise that other person and really make them feel less than. Yeah,
and of course, there have been so many stories nationally about preteens and teenagers committing suicide because they were so hurt by the bullying that had occurred at school. I'm wondering, Catherine, in your experience, how are children hurt by bullying?
Well, bullying actually can be very damaging to children in a variety of different ways. And what happens is often they will turn their pain and their fear and their feelings toward themselves, by having those feelings of despair. And that's where you see suicide, or you'll see some other things like eating disorders or substance abuse use. Other times they may, seek out approval or affection from another person that might be a very unhealthy person, or engage in sexual behaviors earlier than they normally would. Or sometimes they will turn their pain and their aggression outward, and they will be harmful to other individuals, or damage and repeat the behavior on other children who are younger or smaller than they are. It can be very devastating, and adults, when you talk to them, they will have long-term memories and feelings that are very, very painful related to childhood bullying, and will cite examples of adult bullying.
Yes. So I guess children mentally are affected, and emotionally, socially, and you probably see things maybe similar to like what happens with acute stress or depression or the development of an anxiety disorder and other difficulties like that. Probably kids having a hard time at school. I guess there's so many ways, so many signs and symptoms that we see in children who are the victims of bullying. Would you say, Catherine?
Absolutely. And also there's another group that's affected, and that's those that see the bullying. And that's another avenue that we as a school district are looking into, that the other individuals that are watching what's happening or know what's going on, they are also impacted by bullying.
Oh, sure.
Yeah.
So here in Washoe County, in our schools, Catherine, would you say that bullying is on the rise, or is it declining? Can you tell us locally what's going on?
Well, there's been a lot going on. We recently released the Youth Risk Behavioral Survey, which is the Center for Disease Control survey. But we also have been, because of the work of our superintendent, Dr. Morrison, we have been looking into individual schools where we've been doing safety and climate surveys with kids to ask about bullying behavior. And what we've seen as a couple things. We've seen a rise in the amount of students who are reporting bullying, and that's partly due to, we think, raising awareness of it. Nationally, bullying behavior is on a decline. However, cyberbullying is up.
Okay.
And we see something similar of that. Across the nation, if you ask teachers the prevalence of bullying, they usually underestimate it, whereas kids are reporting things that they're seeing that perhaps the teacher isn't seeing. And I would say we're following the national averages, and actually maybe a little lower, but we're trying to encourage more and more reporting, because that's really an important measure.
Okay. Well, Catherine, that is some excellent information that Catherine has shared with us, and we'll get back with her and ask her more about bullying in Washoe County School District right after this brief break. Hello, and welcome back to New Skills for Living. We're talking with Catherine Laden from the Washoe County School District. And so, Catherine, on this topic of bullying, what role do you believe the schools should play in addressing this issue?
Well, actually, the schools play an important role in it. We are creating an environment that's safe and conducive to learning. So we put into place mechanisms for reporting bullying. We make sure that we're dealing with the issue of bullying. We also have the teachers, and also through the school counselors, we're putting together things so that kids know what bullying is, how to deal with bullying, and we're encouraging parent engagement and involvement. And parents are very important individuals when it comes to dealing with bullying. So as a school district, we're doing all of those things as much as possible.
Oh, that's great. And can you tell us a little bit more about then how maybe parents and families are getting engaged with this in Washoe County?
Well, yes, we're involving, we've received a lot of questions related to what's happening across the nation, and we have been spending some time doing some education with students and parents, and then working with our counselors and school psychologists and nurses and teachers about ways to reach all of the kids and to help kids who are bystanders intervene and react with each other. So there are materials that we've put out in the schools. We have DVDs, we have lesson plans, we have resource materials for parents. There's books in the libraries, and it's infused a great deal into the curriculum and the outreach for individuals. And then we work with administrators on what to do when a bullying incident happens, and how to intervene and what to get involved with. And
that sounds really good. Now, I've heard that some of the local schools are doing really well with this, and that some of our schools have received some awards and some cash or some monetary support to help them forward the programs. Can you tell us about that?
Yes, I can. Actually, the Washoe County School District has been the recipient of a multi-year benefit through the Community Foundation. Lily Trinchero, who is a donor who really believes that bullying is important, has a fund called the Celebrate Diversity Initiative, which targets bullying and cyberbullying in schools. And we have had 3 schools win the award this year for the activities and interventions that they've done with their students and their staff. And Reed High School, Double Diamond Elementary School, and Pine Middle School. And actually they've received cash awards, and our Attorney General will be going to the presentation at Pine Middle School to emphasize with the students the importance of looking at the issue of bullying and cyberbullying, and really standing up and taking a role.
Oh, that's really good news. That's great. Good for those schools and good for our community.
Yes.
That's great. If we kind of back up for a minute, I'm wondering, how are the students responding to this? I mean, is there like a student movement where a large group of students are saying we're sick and tired of this, or we're not going to put up with this, and so maybe the culture is changing in the schools, or?
Actually, you know what? I believe that, and and we are seeing with our numbers, we're seeing kids recognizing, and it goes with a lot of our work that we've done with trying to raise kids who are not looking at prejudice and discrimination, and are trying to be cooperative and treat everyone really with the underlying respect.
Oh, that's
and
great.
Students are really wanting to see respect, to participate in respect, and to be recipients of it.
Oh,
and
that's
so
good.
we are, and it's actually very powerful when students stand up for other students, and when students can be compassionate to others who are feeling that way, because it's painful to stand alone. If you're the recipient of it. And so we are seeing kids take responsibility and help one another.
That's great. And maybe in this last 30 seconds, if someone out there has been watching the show and they're concerned about their son or their daughter, their nephew, their niece is maybe being bullied at school, just in this last half minute, Catherine, what can you share with them?
Well, actually, the first thing I would share with them is that Washoe County School District does have a lot of people and programs and materials and things that are there for you, so you don't have to look at this issue alone. You can go and approach your school counselor and administrator. You can also contact the Safe and Drug-Free Schools office, and we would be happy to send you materials and send you things. And we have a pretty extensive piece on the school district's website if you scroll down from students to Safe and Drug-Free Schools.
Great. That's some great information. I wish we had more time. Right after this brief break, we're going to talk with Jeff Rice from St. Mary's. Hello, and welcome back for this segment. We're here talking with Jeff Rice, who is the Director of Outpatient Psychiatric Services at St. Mary's. Jeff, so St. Mary's recently, you've headed up and you've begun outpatient psychiatric services for St. Mary's. And I guess the first thing I want to ask you is, can you tell us a little bit about how psychiatric services here in the Reno-Sparks area is part of St. Mary's mission in serving our community?
St. Mary's mission is to help all those that are in need. Psychiatry was a particularly soft spot for them because they didn't have any at all. So in talking with Mike Ubaldi, the president and CEO of St. Mary's, I asked him if he had an inkling to get his toe in the water, so to speak, and he brought me on board to do just that.
And so this idea of service, and especially serving those that have a mental illness or a dual disorder of a mental illness and a substance abuse problem, is very much a core of the mission of St. Mary's to help those people.
Absolutely. We started real small, even smaller than what we are. We started with a small IOP program out in Galena, and we have since grown and are now located on South McCarran, where we have a number of different services there now.
So you mentioned IOP, and that's one of the things I want to talk with you about, because that can be such an important program. That's the intensive outpatient program. Can you tell us what that program looks like, what it consists of, Jeff?
Yes. Right now, we primarily work with duly diagnosed individuals, usually an addiction and a mental illness. The program is 5 days a week. It is comprised of group work that is 3 hours a day. So theoretically, a person can come to us and get into the intensive outpatient program and be with us 3 hours a day, 5 days a week. Now, as a person stabilizes and as they begin to work their program, they may be bumped down to 3 times a week, say Monday, Wednesday, and Friday, and then maybe later Tuesday, Thursday, and then we have therapists as well that when they graduate from the program that they can opt to see one of our therapists.
And of course, one of the values of an intensive outpatient program, it's kind of like right in the middle. Somebody doesn't have to be hospitalized, do they?
No, not at all.
So people can stay at home and they can get therapy 5 days a week through your program, through your intensive outpatient program. And of course, on the other end, someone might see an outpatient counselor maybe once a week or once every 2 or 3 weeks, but it's for that group in the middle that would really benefit from more intensive help, huh?
Absolutely. And it also works real well with some of the local inpatient psychiatric services where someone is being discharged and still requires some follow-up services, may not be steady enough on their feet, so to speak, that they want to be home all day alone. So we can act as a resource to those folks as well.
That's great. And then you also have psychiatrists involved with your program to help people that have need for medication. Is that
Absolutely. We just started a medication clinic in the month of April. Oftentimes in this area, people looking for psychiatrists have 6 to 8 weeks wait before they get in, and we have been successful in making sure that those folks are seen quicker so that they don't run out of their prescription, or if they're feeling a little bit as though in need, they have a place to go.
Yeah. And we were talking earlier about dual disorder, and some people aren't familiar with that term. Jeff, can you describe what someone with a dual disorder, what does that mean?
Most recently, studies have shown that those with addictions or alcoholism have psychiatric disorders. And those people who have psychiatric disorders are oftentimes abusing or addicted to various substances. So the very nature of those two disorders together requires us to treat that person a bit differently than you would, say, just a straight alcoholic individual or a depressed individual.
Yeah, and of course that's so important because with both of those, someone who has a dual disorder and they're only treated for their mental illness, their relapse is very high, and someone who's an alcoholic or a drug addict and they have a mental illness and it goes undiagnosed and untreated, their relapse is very high.
Absolutely, and we all know that the relapse rate is real high across the board. Though they have started to see some successes with treating folks dually and making sure that both of the issues are being addressed, and the rate of success is going up.
Well, that is some really good information about this really important program in our community. We're going to return after this brief break and talk more with Jeff Rice about the program at St. Mary's. Hello and welcome back to New Skills for Living. We're talking with Jeff Rice from St. Mary's Outpatient Psychiatric Program. Jeff, can you tell us a little bit more about how someone enters the program and engages in the program, please?
Sure. Entering the program can happen a number of different ways, as you know. You can get referred by your therapist, you can get referred by your physician, or you can call us directly at 770-7950. The other end of the phone is more than likely going to be answered by a gentleman named Art Pryor. He's an RN. You would have a brief conversation with Art over the phone where he would make an appointment for you to come in and speak with him. That appointment can run anywhere from 30 to 45 minutes to where he's going to make an assessment as to what kind of services you need. If we don't have the service that you need, we will find a place for you to go. Providing we can help you, at that point he would get a prescription from an order from the physician to enter our program. And at that point, also, you're going to sit with our therapist, and they are going to do what we call psychosocial, which is going to give us all the background information we need to address your issues individually and to meet your needs. Then the decision is made as to how often the treatment plan is going to kind of trigger what topics we talk about with you, how long in the program, etc.
And then, so someone then goes to group and then they see a psychiatrist. Is there also family involvement with this, Jeff?
We can have the family come in. Families primarily come in during individual therapies. So once a person graduates from our intensive outpatient program, they might be requiring some follow-up work. And that may include the families in conjunction with the physician or in conjunction with the therapist.
I was very interested to hear you talk about how someone might be referred by their primary care physician. Of course, St. Mary's Health Network has so many primary care docs who is part of that network. So if someone is seeing their internist or their family physician, whoever their primary care doc is, and they go to them and they talk with them about symptoms of depression, symptoms of anxiety, maybe misusing alcohol, or they're wondering about their use of alcohol or prescription medications or pain meds, the doctor then can call over and refer them to have this assessment done by Art Pryor. Is that correct?
Absolutely, and that can happen a couple different ways. Sometimes the physicians will give the patient or prospective patient our number. Sometimes he will have his nurse call us. Almost always when a referral comes from a physician's office, they will fax to us the information that they have regarding the person, and that kind of acts as that trigger for Art to get involved. Sometimes we even call patients. You know, physician will say, you know, I have a patient that may need your assistance. I've told them that you're going to call, and we may call for the doctor office.
And of course, that call to the patient can be very helpful because there still is a stigma involved.
Sure.
Where people say, oh my gosh, I have to call over there and...
Yeah, unfortunately, psychiatry in general has that kind of old school stigma attached to it. And I think that one of the things that we're really good at over at South McCarran is kind of wiping that away. We have a very nice location there. It's very homey. Art and the rest of the therapists by the name of Lori and Amanda that are very good with folks. We try to set people at ease immediately.
Yeah, and that makes all the difference in the world. Maybe in about a half a minute, Jeff, if someone out there is saying, gosh, that sounds really good and that could help me or my family member, what would you say to encourage them to call and get some help?
You know, if there are questions in your family or within your own head, please give us a call. Run it by someone. You don't even have to give us your name. Psychiatry is very much falls under the confidentiality laws of the state and the country. And you just need to give us a call.
So that call is confidential, and there is help available for people who have St. Mary's and Medicare and Medicaid. We want to thank you for joining us. We want to thank Jeff Rice for sharing with us this great program that St. Mary's has. We want to ask you to come back and spend some time with us again next month when we continue to take a look at various problems and challenges and difficulties that people can have, and then also explore new skills for living. What are the skills that people can have to make a difference in their lives? Thank you for joining us.